How do gene mutations guide stomach cancer targeted therapy? Imagine your body's cells as tiny factories, each with instructions encoded in genes. Sometimes, these instructions get altered or mutated, leading to abnormal cell behavior. In stomach or gastric cancer, these gene mutations are key clues that help doctors decide the best treatment options. Instead of using one-size-fits-all approaches, targeted therapy focuses on these specific genetic changes to attack the cancer more precisely. Common gene mutations in stomach cancer include changes in genes like HER2, MET, FGFR2, TP53, CRAS, and pi3 degrees Kelvin. These genes produce proteins that control how cells grow, divide, and survive. For example, when the HER2 gene is amplified, it causes overproduction of the HER2 protein, which signals the cells to grow uncontrollably. This overactivity can be targeted with drugs like trastuzumab, a monoclonal antibody that blocks HER2 and slows tumor growth. Similarly, if the MET gene is mutated or amplified, it activates the MET receptor, promoting tumor progression. Drugs called MET inhibitors can help block this pathway, potentially shrinking the tumor. FGFR2 mutations or amplifications affect fibroblast growth factor receptor signaling, which encourages cancer cell proliferation. Researchers are exploring FGFR inhibitors, such as bemarituzumab, which have shown promise in clinical trials for tumors with FGFR2 overexpression. Mutations in the tumor suppressor gene TP53 impair its ability to control cell growth, making the cancer more aggressive and resistant to some treatments. While targeting TP53 directly is challenging, understanding its mutation helps in designing combination therapies and predicting treatment responses. Targeted therapies are chosen based on the specific mutations present in a patient's tumor. For example, if a tumor tests positive for HER2 overexpression, doctors often recommend trastuzumab combined with chemotherapy as the first treatment. If MET amplification is detected, MET inhibitors might be considered, often through clinical trials or approved options. For FGFR2 alterations, targeted drugs are being developed and tested, offering hope for more personalized treatment plans. However, there are challenges. Tumors can be very diverse, with different mutations in different parts or at different times, making it tricky to choose the right therapy. Resistance can also develop, where cancer cells find ways to bypass the blocked pathways, reducing drug effectiveness. That's why ongoing molecular testing is essential. It helps doctors monitor how the tumor evolves and adjust treatments accordingly. In practice, when stomach cancer is diagnosed, tissue samples undergo genetic testing to identify mutations or gene amplifications. If HER2 is positive, the patient receives trastuzumab plus chemotherapy. For MET or FGFR2 mutations, targeted drugs or clinical trial options are considered. Continuous monitoring helps detect any new mutations or resistance, guiding adjustments in therapy to keep fighting the cancer effectively. In summary, gene mutations act as vital markers that reveal the cancer's vulnerabilities. By understanding these genetic changes, doctors can tailor treatments that target specific pathways, making therapy more effective and personalized. While challenges like tumor heterogeneity and resistance exist, integrating genetic testing into treatment planning is a powerful step toward better outcomes for stomach cancer patients. Always remember, personalized treatment should be guided by healthcare professionals who can interpret these complex genetic clues and recommend the safest, most effective options for each individual.